Infantile hypertrophic pyloric stenosis.
Infantile means more common in infants between 3 weeks to 3 months. Hypertrophic increase in size of cell. Pylorus part of the stomach. Stenosis means narrowing. So as a whole, infantile hypertrophic pyloric stenosis is a narrowing of the opening present between the stomach and duodenum due to hypertrophy of smooth muscles of pyloric and drum. Incidence high in B and O blood groups, nitric oxide deficiency, smoking during pregnancy, exposure to macrolide antibiotics like erythromycin, clarithromycin, azithromycin, etc., and common in firstborn male child, male to female ratio is 4:1. Pathophysiology and symptoms. Gastric outlet obstruction leads to projectile vomiting, which is non-bilious, and this leads to two conditions: dehydration and loss of stomach acid. Dehydration has symptoms like dry mouth, sunken eyes, no tears, dry cool skin, soft spot on top of head looks sunken. Loss of stomach acid leads to loss of HCl, which leads to hypochloremia, which means the less amount of chloride ions in blood. And the symptoms of hypochloremia are prolonged vomiting. Dehydration leads to low blood volume, which leads to secondary hyperaldosteronism and leads to hypokalemia, which has symptoms of constipation, fever, bowel movements, weakness. All these conditions will lead to decreased acidity, in other words, means increase in pH of blood, which results in metabolic alkalosis due to decreased acidity, which has symptoms of lethargy and tetany. Diagnosis: the patient suffers from serious vomiting. Palpable olive mass, which is 2 cm in length, is felt in the right upper quadrant and mid epigastric region, and peristaltic wave is visible moving from left side to right side during physical examination. Lab studies which confirm the diagnosis are ultrasonography, in which hypertrophic muscle is hyperechoic and central mucosa is hyperechoic. Upper gastrointestinal gastroscopy shows caterpillar sign and string sign. And also paradoxical aciduria confirms the diagnosis. Differential diagnosis of infantile hypertrophic pyloric stenosis are gastroesophageal reflux, gastritis, gastric volvulus, antral web, pyloric atresia, and duodenal atresia. Treatment which involves good hydration with ORS solution and breastfeeding, electrolyte correction, pyloromyotomy, which is also called Ramsted's procedure, and oral atropine, which is alternative to surgery, can have good prognosis. Thank you for watching our video. If you like the video, subscribe and press the bell icon to get our recent notifications. Thank you.